Ashwagandha gets talked about like it can switch stress off. What is the more useful way to think about it?
Think of it as a biologically active plant extract with early signals in stress and sleep. That is why people are interested. But the evidence is not the same as saying every daily capsule is harmless or necessary. The mechanism story is usually about stress response pathways, not about correcting a simple deficiency. That matters because the target is a pattern: tension, perceived stress, sleep timing, and recovery rhythm.
When a study says ashwagandha helped, can viewers assume the gummy, tea, powder, and capsule on a store shelf are basically the same?
The most practical benefit area is perceived stress and calm. If someone tries it, the outcome should be trackable. Fewer stress spikes, easier evening wind down, or a sleep diary that actually changes.
So if someone sleeps better, the lesson is not necessarily that ashwagandha is a sleeping pill. It may be that the stress load changed first.
Exactly. Context changes the meaning of the same supplement. A person with a clear stress pattern is different from someone stacking several calming products or someone with thyroid, liver, immune, or medication issues.
A lot of labels also lean into strength or testosterone. Should that be placed in the same evidence bucket as stress?
No. Rank the claims. Stress and perceived calm get the largest box. Sleep is plausible when stress is part of the pattern. Broad wellness, hormone, and performance promises need more caution and tighter evidence.
Then who is the best fit person? Not as a diagnosis, but as a pattern a viewer could recognize in everyday life.
The better candidate is someone aiming at a defined stress or wind down problem who can compare a baseline week with a trial period. If nothing measurable changes, the label promise did not become a personal benefit.
If the person fits the stress pattern, what should they pay attention to on the product side without pretending all supplements are standardized drugs?
The clean experiment is simple. Choose one hope for benefit, keep the routine steady, and watch one outcome. That might be perceived stress, evening settling, or sleep continuity, not a dozen vague feelings at once. So the useful sequence is: know the benefit, understand the stress response pathway, check whether the person fits, choose a comparable form, and decide in advance what improvement would count.
Now keep the caution proportional. What is the boundary that lets people respect the supplement without turning the whole conversation into fear?
Rare liver injury reports are the serious signal. Yellowing skin, dark urine, itching, or severe fatigue should be treated as urgent warning signs, not as normal adjustment symptoms. Extra caution belongs with pregnancy, autoimmune disease, thyroid conditions, liver disease, sedatives, and other calming or hormonal products. That is not a ban for everyone. It is a reason to involve a clinician and avoid casual stacking. A fair conclusion is not anti-ashwagandha. It may be useful when the target is specific, the response is trackable, and the boundary stays visible. Benefit first, but not boundary-free.